We are going to begin with the healthcare debate. We are joined by Republican Congressman and Dr. Tom Price of Georgia. He joins us from up on Capitol Hill. Congressman Price, thank you for being here. And let me first...
Thanks, David, Rick. Good to be with you.
Thank you, sir. Let me first understand, how are you going to tell a constituent in your district who now believes that their 25-year-old post-college graduate can be on their insurance, that no, you want to repeal that, they cannot be on their insurance?
Out of the 4,600 pages in the bill that was passed yesterday, you found the 2 pages that might actually do something good. You're absolutely right. It's one of the items that we have been pushing for, and that is to allow young folks to be able to stay on their parents' health insurance until they're at least out of college or have a productive job, maybe at the age of 25, 26. The problem is that the vast majority of the bill, the $500 billion in taxes, the slashes to Medicare, the intrusion of the federal government into the decision-making process for health care, all of those things, along with the sleazy backroom deals that were done for Nebraska and Florida and Louisiana, all of those are in the bill that was passed on the floor of the House last night that the president's going to sign. So it looks like what the president's going to sign is a bill that the vast majority of the American people don't want.
And efforts for Republicans to say we're going to repeal the bill are starting already. What is the message? Is it that the entire bill has to go?
Well, I think what the message will be, repeal this bill and reform or replace it with the kinds of things that are positive, that are patient-centered, that put patients and families and their doctors in charge of health care, that actually address the insurance challenges we have, portability and pre-existing, with fundamental solutions that respect patients, not that trust government. And finally, you got to address the lawsuit abuse that was not addressed in this bill. You can't be serious about health reform if you're not serious about lawsuit abuse reform, and that's exactly what the bill did yesterday. It did not address lawsuit abuse.
To try to stop that practice of preventive medicine that a lot of doctors have, but the American...
Defensive medicine, yeah.
Defensive medicine, yeah. The American Medical Association is behind this bill, and I'm curious what you think, how this bill will impact doctors.
Well, it'll be destructive to the privately practicing physician, the doctors that you and I and virtually every American across this land sees for their routine challenges, for the specialty care that they receive. It will be destructive to the relationship between patients and families and those doctors, because the patients will not know any longer whether or not the doctor's doing what he or she believes is in the best interest of the patient, or whether they're doing what the government's telling them to do. And then it'll be destructive to the wonderful innovation that we have in healthcare, the wonderful treatments that we have that make us the greatest nation in the history of the world, as well as the nation that has the greatest health care when you look at disease-specific criteria. Those things will begin to be eroded if this law goes into place and is fully executed.
And I want to be clear on what you're telling the American people about the repeal effort. Is it that if Republicans win control of the Congress, there will be a repeal push for sure?
Absolutely, without a doubt. In fact, we're starting that right away. We, in fact, started it yesterday. Senator DeMint had a bill up right away, or a petition up right away to repeal it. We've got repealitnow.net, repealitnow.net for folks who are interested in going and finding an opportunity to be able to vent their frustration and their anger about a government in Washington who will not listen to them about what they believe they want in health care.
Congressman, do you believe that the bill passed by the House last night is constitutionally sound?
I think there are a number of provisions in it that are questionably constitutional. I believe personally that the individual mandate is unconstitutional. It'd be the first time in the history of our land where the federal government has said to every single American, you must purchase this, and define exactly what it is. I think that's patently unconstitutional, and I think there will be courts that will find that. Certainly there are mandates that are being pushed down to the states, that many states, up to 40 now as I understand it, are going to be contesting whether or not their citizens ought to be come under the federal law. And then, of course, the Cornhusker kickback, the egregious, sleazy backroom deal that Senator Nelson got for Nebraska.
That'll be gone by the end of the week, it looks like.
Well, that means that would have to be gone only if reconciliation passed.
Right.
That's in the Senate bill. That's what all of those folks voted for yesterday, was that sleazy backroom deal that makes it so that even the citizens of Nebraska who oppose it would come out and say, that's not what we ought to be doing as Americans.
Finally, Dr. Price, there was a lot of angry and heated rhetoric out there, outside the Capitol, even inside the Capitol. Congressman Stupak called a baby killer by apparently a member of Congress. I'm wondering if you're concerned, watching this develop, whether we're just having another example of the rhetoric and it just getting a little too hot.
Well, I think what we're having is the sense that the American people have right now that their government in Washington isn't listening to them. They have tried in every way they know how, that is the American people, over the last 8 to 9 months, right, to let Washington know that they do not believe this is what we ought to be doing as a nation as it relates to health care. And from their perspective, and I agree with them, from their perspective, Speaker Pelosi isn't listening, Harry Reid isn't listening, it appears that the administration isn't listening. And so what do you ask, what else can you ask them to do other than to say, can you hear us now? You've got to be listening to the American people. We are about to have a government that no longer has the consent of the governed.
Right.
That's a very dangerous place to be.
Congressman Tom Price, thank you very much for being here today. We greatly
Thank you
appreciate it.
so much, David. Rick, appreciate it.